Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We did one on this earlier as far as regarding the upper extremities, but today we're going to go how to tell what is causing numbness in your feet or legs. Common causes.
Right. So, yeah, and there we've got about half a dozen things that could possibly
We got
cause
at least 7. Well, actually, we got bonus. So we got 8. So I know you don't like that number 8.
Well,
you like 7.
7.
Liz likes even numbers, so she likes the 8.
Well, okay.
So
carry on.
All right. So, by the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to the Facebook and like us because Brad and I, as children, we're not liked. So we're trying to turn things around. It's Bob and Brad.
Bob and Brad.
You can find us. Just look. All right. The first thing we're going to talk about. These are some common ones that happen to people. Sometimes it's happened to me. Not necessarily this first one, but especially women if they cross their legs like this.
Sure.
They're putting pressure right on a nerve right here as it goes over the fibula.
Just below the knee.
Yep, just below the knee. And you can actually, that can cause numbness, especially if you do it, repetitively, day after day.
Sure.
So it's the perineal nerve. And so in order to, if you start getting tingling down the side of your calf and you're like, boy, what's causing that? It may be as simple as that. It may be
Just
pressure.
pressure on the nerve when you cross the legs, so just don't cross your legs anymore.
I've seen some bony people that even laying, like if they sleep on a hard surface, that could put pressure on there. So. The other one is if you take a big thick wallet like Brad has, it's so full of money.
I don't even have it with me. Gave it to my wife. She's going shopping.
Well, there was the old joke about a wallet. Did you hear that my wife's wallet was stolen, but we figured it was cheaper for the thief to have it than for her to have it. So we.
I hope our wives aren't watching.
Yeah, no.
But anyways,
they never watch.
Yeah.
So anyway, you put a thick wallet in your back pocket. You can get pressure on your sciatic nerve.
Sure.
And this happened to me when I was driving one time, and my legs started going entirely numb, and I couldn't hit the brake. It wouldn't. I mean, it was terrible. It was really scary. I had to switch feet.
Yeah, that's why I put my wallet in my front pocket.
So good. That's what I do now. So I actually usually put it on the seat next to me or something. But so.
Nobody
All right,
cares.
moving forward. Okay, next thing. So those are very easy things to correct. Now, the next one is called Tarsal tunnel syndrome. And this is, we have a nerve that travels. Brad's going to demonstrate here. We have a nerve the posterior tibial nerve that travels right down behind the medial malleolus, or what do you guys?
The
ankle
inside
bone.
ankle bone.
Yeah.
Right there.
And there's a little tunnel that goes through, just like carpal tunnel, up in the upper extremity. You have tarsal tunnel in the foot. And this can get worse by if he's got like flat foot and putting stress on it,
Yep. So
or if you sprained your ankle.
Sure. Either swelling, stretched, whatever is going to put pressure. And you can test it by just tapping right below the ankle bone and the heel bone there in that hollow spot. And just start tapping there for about 30 seconds.
And see if you start getting symptoms into the foot. Sometimes you'll even see it swollen there.
Sure.
I mean you can, so.
Yep.
Anything happening, Brad?
No, I think I'm pretty
clear.
I'm clear,
So.
except for my coloring is coming off from the tarsal.
The tunnel's falling
so
apart.
I'm getting better.
All right, the next one, Brad, very common, especially nowadays with diabetes, is peripheral neuropathy.
Sure.
Now with peripheral neuropathy, peripheral means out to the sides. Central neuropathy would be, the central
core,
spinal cord.
You have the trunk.
And nerve obviously means, or neuro means nerve, and pathy means abnormality. So usually your nerves are damaged, and they can get better. I mean, they can heal, especially depending on the damage. But there's really a lot of different types of neuropathy. There's like 100 types.
It's one of those kind of words that's maybe abused and people don't really understand it, and if you just.
Well, it can affect the motor nerves. It can affect the sensory nerves. It can affect the ones that are sending, signals up, and the ones that are sending signals down. So you can get burning, a cold sensation, anything that involves the nerves.
Right.
It can be shiny looking.
Usually it's global. It's not just on one side of the foot or the other. I call it stocking distribution, like if you pulled a long stocking up wherever the stocking is.
And probably both sides too, right?
Right.
In most
oftentimes,
instances.
yes.
So that's going to be a clue, and that's obviously something that generally your doctor is going to diagnose.
Right. We don't have any stretches or any tricks to get that, except for maybe exercise with circulation if it happens
yeah,
to be
the more
related.
circulation, hopefully the more it would heal. And we've done a video on that before.
Sure.
So next one is peripheral artery disease. Now instead of the nerves being affected, it's the arteries. And generally what you're finding in that is the arteries, they don't have as much blood flowing through them. There may be some atherosclerosis, some buildup of fat.
They're getting plugged up.
Yep, they're getting plugged up. Good way of saying it, Brad. And there's not as much blood flowing through it. So what often you'll see in this case is someone will walk so far and they'll go, oh, I'm getting pain in my calves.
Right.
And it's kind of a lot of times equal. The concern with this is if you have this, if there's blockage down there, there could be blockage in the heart, and there could be blockage up in the brain. So you're at risk of a heart attack or a stroke. So you definitely want to get that diagnosed to see if that's the case.
I'm very familiar with that because my father had it here. He had it in his arteries here, and his heart was plugged up. He was pretty much plugged up head to toe, his last few years. And he always, after he had walked a few blocks, he would say everything would be painful, and he thought it was an arch problem. He was convinced his arches in his shoes weren't any good. But I'm sure it was just blood flow issues.
Exactly, very common. I've seen it when I work with people who have amputations because of they lost a limb because of it. So, all right, next one is a herniated disc. So a lot of back problems can send pain and numbness and tingling down into the legs. If it's a herniated disc, one of the simple tests you can do, and so the disc is pressing on a nerve, is just have the person lay down. And we do it. Let's say he's getting the pain on this side. A lot of times it's one-sided. Disc. And you can bring the leg up like this.
Straight knee.
Yep. And you can put that one down.
There you go.
I'm going like this, and then I'll go up to the point where he starts to feel a little bit of pain. I'll back off, and then I'll push the foot down like this. This is called a straight leg raise, and we're checking. And if this increases, not the stretching pain, if it increases your numbness and pain in the back, pretty good sign you have a herniated disc.
Particularly, go up to there. Let's see you start to feel some pain there, and then you add that dorsiflexion to the ankle movement, and that really hurts here, not here. That's a real positive test.
You can even have the person bring their head up too.
Yeah, and if you do that, it really stretches the nerve.
The spinal cord all the way along there. So. So just a little helpful hint. You need a little help there to do that one if you want to check.
Yeah, it's hard to do that one by yourself.
Now, Brad can speak to this next one, these next two really kind of, spinal stenosis and spondylolisthesis. In both of these cases, you're going to be getting pain down the leg. And in both of these cases, it's going to feel better when you kind of bend forward. So they call it shopping cart syndrome. Like it feels better when you lean on a shopping cart.
When you're walking.
Yeah.
Walking typically is uncomfortable, but if you lean forward a little bit, it feels better. I know myself, if I squat down like this, that feels so good because we're opening up, taking the pressure off the nerve.
And sitting feels better. It gives you, these are the people that'll say, I can walk so far, and then I just have to sit.
And when you sit down, it's immediate relief. It just feels better right away.
You do that one where you put your foot up on a stool too, don't you?
Yeah. I've been fortunate. I've been able to treat mine so it's not near as bad as it was. And that's going to be case by case. But I do this, and that helps. And I think I've got a SI issue that compounded with it.
Is there anything else you got, Brad?
Well, I'm afraid to go to the doctor and find out.
We're actually, I'm really impressed with Brad. I've said this before. If Brad wasn't a therapist, I think you'd actually be disabled. I think you would have probably had surgery already, and I think you would have been.
Yeah, who knows?
So instead of just mentally disabled, you'd have been...
Right, from the neck up, we don't want to go there, but from the neck down, things are okay.
So the bonus issue is sometimes they have what is called false sciatica, where you actually have the piriformis muscle involved. Piriformis is a small muscle in your butt, goes across the sciatic nerve. Or sometimes the sciatic nerve pinches or pierces it, goes right through the muscle.
You were born that way.
Yeah, you're born that way.
They call that an anomaly.
So generally, one way to test it is, if you're having pain down the right leg, I usually bring the leg up and pull it over to the opposite shoulder. This one goes down, right?
Yeah, I usually do it down. And right there is where that piriformis, and if you test one side to the other.
Yeah, and this one feels really tight. And then I do this one, and this one goes much further and feels good. it's a possibility. There's other signs that we could go over, but
Sure.
we're going to try to keep this video simple, so we just wanted to go over just the basics here.
Right.
So,
You know, if we went into detail on all these, we could be here for about a week.
yeah, hey,
You know?
exactly. And people, they've already tuned us out, so. All right, everybody, remember, we can fix just about anything
Except,
a broken heart.
there you go.
But we're working on it. Thanks for watching.